Very good evening, everyone. I am Arpita from the IGCP group. Welcomes you all to this very interesting topic today, which is mastering grade 7 baldness, combination of FUT and FUE for 7,000 plus crafts in single hair restoration session. And yes, to address this very crucial and very interesting topic, I would say we have with us someone who is a specialist in this topic. None other than Dr. Avinash Agarwal, sir. He is a director and head consultant at Acube Aesthetic Clinic, Mumbai. So, sir, I would now request you to please start with your presentation. Over to you, sir.
Thank you so much, Arpita, and thank you, MedTalks. Thank you, ICGPC, for this beautiful opportunity. I myself, Dr. Avinash Agarwal, an exclusive hair transplant surgeon for over 17 years. I started my journey of exclusivity in hair transplants in 2008, where I took training internationally and came to India with the expertise of how that we can do the best to give the world a head full of hair. I always tell this that beauty lies in the eyes of the beholder, and definitely somebody who wants to look super beautiful or somebody who wants to have a very framed face needs to have a hairline, needs to have a head full of hair. And hence we do combine techniques in which hair restorations can be mixed up. There are technique which is the most standard technique or a gold standard technique called as FUT. Because I'm a surgeon, it's a very easy technique for me to just take out a strip of skin and sliver the skin into pieces, which is where follicular units are extracted and of course planted back similarly. And of course, having done this for more than about 12 years exclusivity, and then of course doing FUE also in the last so many years, since 2012 and 14 is what I started the FUE procedures. Of course, the punches size kept on varying from 1.2 mm. Now it's almost zero point 0.6 and 0.7 mm. And that's how we remove grafts with such fine expertise. Thank you once again, MedTalks, for this follicular unit extraction and strip surgery combination technique, which I'm going to explain and make y'all as a master too. Now, if you see that FUE typically was done with 0.8, 0.9, and even 1.2 mm punches for graft extraction. Maybe it could be motorized or manual. Of course, from the safe donor zone, which was taken from the head, from the back of the scalp between the tragus of the ear on both the sides, drawing a line perpendicular upwards, and of course, all the way back, almost about 4 to 5 centimeters or inches in the middle, and about 2.5 to 3 inches in the sides where we can extend our incisions. And of course, from the center, right in the center where the FUT extractions can be done, which is maybe, it could be all unpredictable, maybe about 30 to 35% of the donor zone that can be actually taken in an FUE extraction. So FUE is something that one needs to be very careful while extracting with the kind of punches that you use. And in an FUT, it's typically the length of the strip that is drawn and the breadth in which the strip is taken. Most conventional technique will allow us about 1 to 1.5 centimeter as the central thickness of the strip. But if you do a combination technique wherein there is a fenestration pattern above and below with the FUEs, the laxity of the skin becomes even better, and allowing us to even remove about 1.75 to 2 centimeters of thick strip. And that strip can easily draw up to even 5,000 grafts for a averagely dense patient who has different density to the donor density that we call. If the donor density is about 100 to 150 hair per square centimeter, roughly on an average about 25 to 30 square centimeter is what you're removing, and that can easily draw minimum of 2,500 to 3,500 grafts. And of course, if you're going with the thickness of the length, maybe up to 2 centimeters also, it's as usual as double of it. Now, the expected yield usually about 3,500 to 4,500. And of course, as I said, 22 centimeters of white strip, maybe up to 5,500 grafts also. So all these techniques can be combined to make the hair dense as you want. And of course, the important factor here while doing the combination technique is to remember is the time out of body. Now, the duration that the hair can be left out of the body is from 2 to 4 hours at a max. If you go beyond 6 hours, when it's not implanted back into the skin, it is something that you will lose the quality of the grafts, and the survival of the grafts will keep on reducing up to about, say, 15% every 1 hour of the delayed after the 6-hour time that has been set. Of course, the safe donor zone is most important that I've already explained to you. That's from between the two tragus and the head at the back of the scalp. Of course, today's time, the safe donor could also be taken from the beard hair, from the chest hair, the underarms, and the pubic hair as well. Of course, harvesting involves you to take about 15% of the extraction done, where the donor zone is always miniaturized. And of those hair which are miniaturized should be avoided, and of course, they eventually fall off much faster. And hence, the result will be a little poor yield. And of course, the result needs to be waited for a little longer if you're taking those tiny baby hair also, which is the villus or the tiny hair. In an FU, of course, the survival of the grafts are known to be more weak due to their thin and their reduced tissue around it. And hence, of course, I would always say FUT should always be combined to give a very good thickness. And of course, the longevity of the grafts are much longer. Comparatively, in my expertise and experience, about 3 to 5 years' time, when an FUE patient would come in and do a little more extra graft plantation, while versa, and an FUT patient would take even up to 15 years, would not want to come and do an extra transplant for density. Of course, the safe donor zone that we talked about, it is the middle center part. If you can see the pictures here, of course, there is a high risk thinning in the upper and the lower part, from which also the grafts can be sometimes taken, depending on the age that the patient has gone through. If the patient is very young, always stick to the safe donor zone only. If the patient is beyond 55 to 60, you can see the density which is still available, and try and take the most thicker hair, that is the anagen growing hair, that will allow you to grow the hair in the front also. Now, as I said, the hybrid technique or the fusion technique, also called as my favorite word, is FUET, a combination of follicular unit, strip transfer, or excision together. A large number of follicles can be drawn even with the limited donor zone. The strip harvest is to maximize the donor capacity from the safe donor zone alone, and the laxity of the skin, which increases and is improved due to the harvesting of the FUEs taken from above and below, allows it to take a larger, thicker strip. And in FUET, that is a combination technique, consistently one can easily drop to 7,000 grafts. And with about FUE and FUT, as you see, there's about 3,000 to 4,500 grafts can be taken averagely in each procedure. If you're seeing that the donor zone is completely from the safe zone only, we are doing a combination where technique where FUE is majorly taken from the safe donor zone is about 3,500, and the strip can add even up to 2,500 if the strip is very minimalistic taken, even for patients who have multiple donor scars or done FUTs multiple times in the past. Of course, generally up to 9,000 grafts can easily be taken as well if you're having a nice donor density. Now, of course, grade 6 and grade 7 are the areas where the donor density may not be that good. But of course, the area coverage also will be a little lesser, but still allow us to take out a minimum of 5,500 grafts eventually in any case of grade 6 and grade 7 as well. So, of course, what are the benefits of FUET as a combination? It is a potential technique for large number of grafts in a single session. It is better strip closure because of the laxity of the skin. The reduced tension of the scalp closure or post-operative ease can even help do multiple FUTs in the past, which was done in the past or can be still repeated in the future, and allowing us to have these slivering and the cutting of the grafts done while the FUE is being done. So remember, the FU strip is bought out first, then the FUE starts. The strip hair is already been in the process of getting slivered and cut. While they have been arranged, the FUE grafts which are bought out are also been put back into the scalp skin, while the slits have been pre-made in the present. That is when the surgery starts, the strips are made. Now, what the teamwork is most important here at this point, we have maybe 2 to 3 trained doctors and qualified nurses who would come and help you extract quickly. Maybe even the strip closure is very important, which takes about 40-45 minutes. And of course, some technicians which will help you to cut the grafts. So the team has to be a little larger compared to a regular team, maybe about 5 minimum up to 7 people. Of course, the surgeon is engaged in the scoring incisions, in the slit creations, in the forceps implantations. Of course, all these methods, that is the choice of a surgeon, but these are preferred ones because many people can start to implant together while be able to put the grafts back in. You're not looking at the implanter pen or looking at someone single individual hand implanting these many number of grafts, which would take easily up to 5 to 7 hours, and of course the time of the body is increased. So definitely we want 3 or 4 implanters doing their work together, and hence the team and the coordinated efforts of the whole process is very important, wherein we can finish the whole process within 7 to 8 hours, maximum up to 7,000 grafts in that number of time. Now, time is crucial, as I just told you. In an FUE, when we're taking about 2,000 grafts, may take roughly around 2 hours. The slit preparation takes about 1 to 1.5 hours. The strip harvest takes about 45 minutes, and the closure of the skin as well. And implantation of the grafts, typically in an FUE, would take about an hour, and for the FUT, would take about 2 hours. So if that's the kind of speed, that's the kind of what you call coordinated team effort, and the factors has been taken good care. Of course, the duration of the procedure can be reduced to even up to maximum 7 to 8 hours, and the implantation or the viability of the grafts will typically remain all this while. Of course, the main concerns in FUE-T procedure is the hydration, keeping the grafts constantly in the physiological solution, maybe hyperthermosol, Ringer's lactate, or even for that matter, today's bio-FUE, wherein we use PRP injection or PRP plasma, which is used to store the grafts. The cool temperature between 4 to 8 degrees, somewhere the temperature from the scalp to the grafts, and then of course back into the scalp is something that's to be taken care. The ideal time out of body is between 2 to 4 hours, as I just explained, and the survivability of the grafts depending on the implanted techniques. Now, of course, the word of caution here is the patient expectation has to be brought down way before the procedure is done. Understanding the self limitations and the expertise of the well trained technical team, then doctors that you have. There are large dangers for the large number of grafts wherein the grafts are spread out and there's low density appearance, which is not very good and happening. So remember, tell the patients what you have and what kind of density that you're able to provide them. And hence, with these large number of grafts, also would be able to give them that dense number of hair which they're expecting. So remember, bring the expectation down. Tell them to be more realistic. Maybe just grow their hair about 3 to 4 inches long. Try to comb over to one side, and still the look will be phenomenal. So, of course, need of the hour, and most of the people are wanting to have better results, and of course, in just single session. I've always believed and followed the dictum of doing the single session technique alone. I do not go for the second day or third day transplants unless if the patient desires to do more transplants taken from different zones of the scalp or the beard or the head or the chest. That could take the second day of procedure, but of course, try to finish as much up to 7, 8, 9,000 grafts in a single day. This is how the strip, like typically the marking of the patient with grade 6 looks like. You can see the right in the center, the two lines are the areas which is left for the FUT. The above and below are the areas from where the FUE will be bought out. This is how the donor typically looks after 1 year. You don't even know where the hair was bought out from. And this is what the area after having shaved looks like. We leave about say about 1 or 2 millimeters hair at the strip area so that the holding of the grafts is not with the skin but the hair, while the slivering or the cutting is happening. And of course the sutures are done in the continuous fashion, maybe a single layer or double layer. And of course there is FUE above and below, which is easily we can draw up to 3,500 grafts from above and below area, and using a punch of zero point 0.8 and zero point 0.9 mm sometimes, depending on the graph's thickness. If the graphs are 2 hair, 3 hair minimum, we have to take about 0.8 mm punch. And if the graphs are about 4 also, we can sometimes go up to 0.9 mm punch. This is how the patient looks before, and this is his looks in the front after. These are the side views of the patient. So of course he phenomenally has covered his scalp. Definitely is keeping his hair too short. Definitely keeping more density is what if his desire. He can always go for another set of FUE. But of course I would right now wait till his hair all grows in. This is just about 6 months time after the procedure. Sometimes in an FUET as a combination procedure, a strip if is done. This is almost for a patient who's done a surgery before and now wants to get another fill up. We do about a strip which is taken from about 3,015 grafts and an FUE for about 2,800 grafts. And this is how the appearance looks like. These are the graphs which look how they are arranged in an FUT. And an FUE, of course, the graphs are more bundled. They're more even to look at. Of course, they are very, very crisp and clear. And hence, I think most of the doctors and the dermatosurgeons prefer to do FUE than in today's time doing FUT, which has been the gold standard for the plastic surgeons who are performing then. Of course, in an FUET as a combination, as I said, the wide end of the scar and the excision and the repair is done together. And hence, you can allow the scalp tension to be easily eased out for the post-operative period. And hence, a large yield and a good quality, suturing and healing of the whole area. Of course, for patients, you can work your way through. For patients who have very bad scars, post hair transplant, maybe up to 2 FUTs done in the past. You can see these pictures. And here, of course, the whole scar was excised with all the grafts taken from the scar as well, and above and below, so that the closure can easily happen. The space between the hair above and the hair below, that needs to be closed very gently and without any tension. The FUE, as the fenestration on the whole area, is allowing me to close the skin much better. And this is how the hairline is designed for the same patient, up to more than 2,500 grafts roughly. So this is about 1920 grafts. And post-operative, this is the result that you can see. A very nice, fuller looking hairline. Of course, the hairline will keep getting denser in about 4 months more. Remember, the FUET or the FUE extraction continues even after the strip is harvested and needs more number of grafts. You can always determine that after the slits have been created. Now, what you start off is basically taking off the strip of the back of the scalp. Then you turn over the patient, create the micro slits that you need for the number of grafts that you're going to create to be able to fill the whole area. And then, of course, again, switch the patient, turn over around and start taking the FUEs while the FUT is getting ready. You can always have somebody even implant at the same time while the FUE is being extracted. So you can have multitasking can be done all together as well. These are just a few pictures that want to highlight where patients have done the frontal part and of course now losing at the back as well. So you can do combination technique so that the areas can be easily filled in, where medical management becomes the mainstay, not just mastering this art of having your areas to be filled in with large number of grafts and achieving great heights and feet. But remember, your first step is to achieve your patients to save what they have and create in among those areas to be able to fill up the whole area. But do not really just say that, okay, fine, even if you're just semi-thin and you're looking at those hair and say, I can just plant you all over and do not take any medications. This is a very wrong technique that one would advise. Again, this is about 3,500 grafts, not in a major way, but of course, this patient comes once, not just twice, but thrice. He's done initially with an FUE on a doctor's cabin, was not satisfied with the density, came to me for an FUT procedure. We did a combination, and then, of course, we filled in the areas at the back as well to create a nice, fuller look. This is a young patient, again, a combination technique with more than 8,600 grafts done in 2 sessions. This is the very first session. You can see how his look is. He looks like a young boy again, as for his age. He's 24 and he needs to look his age. And we've been able to sort him up with this kind of density, with where he comes in a grade 5, a lot of thinning all over area. But of course, the thin hair did not have any scope of growth back again. But we had to just do his transplants maybe twice. So this is how the whole look is at the sides, the top, and of course FUET. Who doesn't want to know when it's to be done, where, and how? Now, keeping this important topic, we know that there is a large number of graft requirement in today's times. Patients with grade 5, 6, and 7 also for larger cover areas. Difficulty in skin closures due to previous scars, and that allows you to have good laxity when the fenestrations above and below with the FUEs have been done. The skin laxity is much better and your closure is much, much tighter. So you can just give in loose sutures, leave it at that, take out the grafts, and then just tighten up the whole stitch all the way. Of course, the scar revision sometimes for an FUT, which also yields some more grafts for you, and maximum density that is done in a single session, that is in a single day procedure, with the same anesthesia and no other complication that you're looking at, with the safety of the patients first. Of course, multiple benefits involved here is the revenue for the doctor, of course, large number of grafts, which is large number of money. Of course, I charge per the graft, and of course, happier patients because they're looking for more density and more volume, and you as a surgeon can achieve to do that. Where, of course, it is done in operating surgical setups, which is containing full-time operating rooms, of course, with technicians and OT tech assistants who are well versed and trained with ACLS, cardiac life support, and are well trained in the technology of hair transplants and surgery so that they do not goof up in the procedure as well. Your own personal trainers, doctor or technicians would be the best for you to get the best results. Train them personally, be with them. You can be their best guide. Of course, concerning patients who are more into demanding patients or high paying patients, they are the ones who need to be handheld and kept close for every step that they take. So especially the post-operative care, the intraoperative care, and of course beyond which, of course, for another 10 to 12 days, you have to be handholding them thoroughly. So patients who are willing to have for hair being cropped and not in a hurry to grow new hair on the scalp for the future cover, they are the patients who are willing to go for these kind of procedures because, of course, that faint thin cover on the scalp looks really phenomenal with an FUT because the hair are left a little longer. And of course, avoid the scar stretching in wider strip which have been taken. And this is what is most important, that do you think that the scar will be worsened or the scar will be just approximated well? Yes, it will be if you do the FUE above and below. And how it is done, of course, it is done with the team effort, nothing but the team effort and your team's effort. And how do you actually achieve the team effort is, of course, you train them well. You sit and discuss the pros and the cons, the steps as you go one by one. And of course, the patient's awareness is important with all the pros and the cons. The safety, the pre-operative, post-operative, and the determination of the safe donor zone is important. And here I would also like to emphasize that patients today's time really demand for doing body hair transplants, which is taking hair from the beard, which is the shadow area of the beard area typically. Of course, sometimes the cheek also, if they demand. You can use finer punches to give them minimal scarring, but the scarring is always there. And of course, you can take hair from the chest, from the underarms, from the private areas. Of course, that can even add to the volume. Of course, you may need to wear your hair short and up to a centimeter long at the back because of the scar that is done. If the FUT needs to be covered well, and so they need to know that they cannot keep a crop cut or a military cut at the back of their head because that is where the scar needs to be hidden too. They may need multiple sessions as well after that to increase the density, for which we can again add more FUEs. Remember, one can easily do up to 4 FUVs in a lifetime and up to 3 FUTs without a problem, without having a donor being much compromised. But remember, everything is done about the average out area, that what you need to fill in and what is available to be able to fill in. You cannot take away the hair completely from the donor area and try to fill the front. And that's the reason, you have to really be the right judge. And of course, the onwards grade stage 3, stage 5, and stage 6 also are the cases which are typically done with the combination technique. And in grade 7 also, with the word of caution, can be explained well. Of course, to conclude here, I would like to tell you that maximize your density with the possible coverage for the client satisfaction. Exclusive FUE can also be providing about 5,500 grafts in today's time that we can easily do from an average density donor. And of course, the multiple FUEs can be done in the near future as well. I usually ask them to come back after a year for density of case. And in FUT case, up to 4,500 and 5,000 grafts easily can be done from a strip without having to trouble. But yes, the moment you plan to have an FUE also for the same patient, you can extend your strip thickness that is up to 2 centimeters, and the length of the strip also can be much better. Overall, the graft could be up to 6,500 also without a problem. And beard extractions can be up to maximum 2,500 from the shadow area, and chest hair can be taken out, which is about 2,000 2,500 from the chest bilateral by the sides. And if you're doing the underarm, maybe about 1,000 more. If you're doing the pubic area, around 400 to 500, even more. So all this area hair can be taken and can be infused into the scalp in a different way so that they do not look absolute. That means you can always mix these hair for the top and the crown area, vice versa for the frontal area, up to 3 to 4 finger space. Try and use only the scalp hair, which will look more natural for them. Of course, the combination technique for the frontal one third of the scalp typically is about 4,500 grafts, and the front half of it, which is the 100 square centimeter, but not enough for the large area to be covered, and hence higher density is required for those patients. So to cover that area at the back, you probably have angulations of of the hair being placed in a way that the hair grows in such a way that they can easily cover hair over hair, and do not want to actually show the hair coming out from the scalp in a perpendicular fashion. So remember, the right angle, the depth, the direction in which the hair grows is completely depending on your surgeon's accuracy and expertise. And to go for it, of course, we have nothing none other than Dr. Ronald Shapiro, who actually said how a donor potential can be exemplified by the use of combination technique of FUE and FUT in the World Congress, 24th World Congress long back. And then, of course, with that expertise and that experience, I took over this idea of doing something very unique to all my patients. These are some before after pictures. You can have a look. Of course, patients with lots of grade 5 almost reaching there gets a fantastic look in the front. Somebody who's just desirous of a very good hairline, reducing the forehead size. This is also something very unique that one can easily achieve. Somebody who's really growing old now, 65 and 70, wants to look as young as 40s. You can do that, definitely. If me at 46 can still look like 20s, maybe I think I can make people look still younger for sure. Thank you so much once again. Thank you once again from Acube Aesthetics and Hair Next Gen. Acube Aesthetics Clinic all over can really help you grow your hair with the maximum density that you desire. And once again, thank you, MedTalks, for this beautiful opportunity. May I have any questions, please?
Thank you, sir. Thank you so much for your very enlightening talk, I would say. And with that, I would like to ask all our audience if you have any queries, please go ahead, please put them in the chat option so that I can read them out to sir. So, meanwhile, let me ask you the questions that I have already received.
Absolutely.
So, this question is from Faridabad. He wants to know what are the long term outcomes and satisfaction rates among your patients who have undergone this high density restoration approach?
Yeah, absolutely. I think patients who've got this transplant, I've started doing this combination technique in 2014 and 15. And looking at these last 10 years of expertise with these, they have been phenomenally happy. Remember, every 3 to 5 years, the density has gone down a little bit, a certain extent, maybe about 20, 25% to 30%. But I have recovered that density back again by using medications, PRPs, GFC injections, and sometimes even synthetic growth factor injections. All that has allowed the hair to come back in a better way, of course, with none other than cyclical nutritive therapy and applications like minoxidil and RCP, Redensil Capexil Procapil. Having done all of this, yes, the patient's density remains the same, and even at 10 years, I think the combination technique is the best. I, as I just told you also in my talk, the FUT hair, which usually were about chubby, or I would say something which had a lot of tissues around the skin, are the ones which have really survived the test of time. And they have really made this the expertise of the longevity of the hair transplant a thing of today. And hence I tell patients, or I persuade my co-colleagues and people that they should do combination techniques wherein they'll be able to have the density well maintained for longer years, so that the patients do not have to take multiple sessions every 3 to 5 years.
Right, sir. Thank you so much for answering this query. Next question is, sir, can you elaborate on the challenges faced during the procedure, particularly in regard to anesthesia duration and patient recovery?
Absolutely. So remember, sometimes the procedure can extend even up to 8 to 10 hours. Now, depending on what number of grafts you're planning, as I just told you, When we are doing a strip, the strip takes about 45 minutes to an hour maximum to fetch in and suture the skin. Of course, the slivering can continue for the next 3 hours more. So about 4 hours of roughly the FUT grafts are kept out of body. Now remember, the time out of body already has started, so they are already out of the body for lost 4 hours, and they need to go back into the scalp skin. But during that meantime, when the FUT has been dissected, the FUEs are already coming out. So the time that the FUEs are outside the body, no, they are lesser outside the body. So remember, the kind of tissue that is around the FUEs are lesser, but still they go back early in the scalp. And the FUT, though being having a lot of tissue around it, even if they go a little later, they do not have any what do you call? They do not die down very easily. So they survive much better. This has been the major way to look at that, how you will be able to achieve the results, so that you can, what you brought out is what goes back into the scalp within the 6 hours duration that we're looking at. And of course, the anesthesia that we use is nothing but a simple oxycodone injection mixed with about Ringer's lactate. That's my major way to dilute the solution. And remember, that combination allows the fluid to stay in the scalp. If you're mixing or diluting with normal saline, if you're diluting it with distilled water or something like that, that dilution is not going to stay in the skin. They're going to be absorbed very fast. So that's the physiological solution which allows the anesthesia stay into the scalp for a really long time. And our patients, even for 15 hours, would never complain of any pain. Rather, I would say that when they come back the next day to have a wash, they still have the scalp really numb. So the numbness is not going away very soon. And since it's a cardioprotective and non-toxic, without any preservative, something very, very safe as anesthesia is what I urge that everybody should use. And of course, use very minimal adrenaline. You do not really push in a lot of adrenaline. 1 in 2 lakhs, 1 in 2 lakhs strength is enough for the strength of anesthesia, adrenaline that you need to use. And that really works for anybody. All my patients, right from diabetics to anybody who's have any hypertension or issues in the heart, and been on clopidogrel for some time and now back only on aspirin, still I'm operating on them. This anesthesia works wonders. You don't have to worry about any anesthetic complications with this. And remember, be little, and that also works enough. Stretch your skin, right? Have your assistant hold your skin. Do not keep on filling fluid inside the skin. I always tell that all these secondary problems can be taken care of if your preoperative investigations and your understanding to the patient is taken well care. You should always ask patients questions like, do you get swollen up if you have an injury on the scalp? Do you think if you just get a little injured, maybe you will have some kind of reaction to things? If they have any such doubts, any reaction to anything that has been in the past, that will help you to be more standardized in practice. That is, you can start giving them pre-operatively corticosteroid injections, or just a tablet that would be a prednisolone or a Vicilon tablet that will allow the swellings to completely subdue. And remember, post-operatively, tell them to just lie down, be a couch potato, sleep for 3 hours to 3 days. Don't have to really get up and do anything besides your washroom and your food. All these things will completely take away the swelling from the scalp, and they will be seriously not having any problems at all. I'm yet to see any complications in 2012 and 14, because of course, yes, in the past we were a little careless somewhere. We used to allow the patients to do a lot of things, and also smokers or alcoholics or patients who have had any bad history of drugs. All that needs to be taken good care. I always tell patients, choose your patient right. You'll never go wrong. That's how it is.
Right, sir. Right. That was a very prominent answer. And next question is on choosing the patient. Like he wants to know that how do you determine the ideal candidate for a combination of FUT and FUE approach, especially in the second grade baldness cases?
Yeah, so basically, again, patients who need a very large density, they are desirous of having their crown covered in the very first session, or those patients who are comfortable with having you to operate for at least 8 hours, 7, 8 hours, and if you've understood their mental, physical well-being and understanding, you would first evaluate that how much is the quality of the hair at the back of the scalp, what is the number that you can draw. You can use a densitometer, you can use a laxitometer, you can always do the stretch test on the area at the back. All this tests will allow you to be able to choose the right patient. Of course, once the patient is chosen, in the sense that the patient is wanting to have a lot of hair graft filled in and is allowed to do this procedure, is fit enough to even take 2 flights without having to pant too much, or is physically well, you do a little basic blood test routine, which is right from hemoglobin, CBC, ESR. You would like to ask the PTI, APTT, PTINR. You would also do some kind of viral markers, if any, and LFT and RFT. Of course, once the patient is absolutely stable in all the sorts of problems, or maybe an ECG as well, you can probably proceed with the procedure for such patients. So remember, grade 6 and grade 7, or even up to grade 5, you can do a combination easily. Patients who have what you call reservations for not having a strip or a scar which is single line, you can always just hold on to just doing an FUE, so that there is no scar as such. Because remember, they will have a scar of an FUT scar. And of course, in very good hands, excellent hands, there could be just as faint line as the line in your arm, in a palm. So this palm line is as fine, and as fine as what you will see on the scalp. But remember, again, if they have still a lot of reservations about the cut and the stitch, you can always go for only FUE. Maybe start with one procedure of about 5,000 grafts. Come back after 6 months to a year's time, maybe do around 3 more thousand grafts. It will be a good sufficient number for them. Thank you.
Right, sir. Sir, very interesting question. That is, do you foresee advancements such as robotic assistance or regenerative therapies playing a role in improving outcome for extensive hair restoration?
Absolutely. I think robots is already in the play. They are not even just for extraction. They have already started doing the slits. So I think the surgeon's work is kind of almost gone to the robots, and as the robots are doing their scorings, they are doing their slits. Of course, what the surgeon is left with mainly the anesthesia now. So I think you can have anesthetist who will do the part. So I think they just don't need a surgeon anymore. But I would not say that. Yes, of course, the acumen and the expertise of the surgeon only will allow you to remove that number of grafts rightly. And of course, the angulations in which the robot is placed, plus the slits in which they are created. As I said, the slits have to be so well wise and placed. It should not be perpendicular to the skin. It should be always having an acute angle somewhere in the skin of, and also the directions can be depending on what the hairstyle would be. So all that care if taken, even with these number of grafts, one can have a really fuller looking head. And for that matter, if you're looking regenerative medicine, which is right from exosomes to use of other drugs on the scalp, which is the available synthetic GFC or growth factor injections, all this will allow the hair to come back in a way that they will stay for another few more years. So remember the delaying of the hair transplants, which will start in a big way, because what has happened in the last decade that I have seen as a big change. I would always have patients in my 2009, 10, 11, maybe around 35, 45, and 55. But today my patients are 16 and 25. Do I really want to really treat those patients who are so young and having lost all of it, literally all? They don't have any hair all the way till their crown, and that's what grade 6 and 7, which they come up to. I feel really this is not what their age is for this. So I remember these regenerative medicine procedures, right from tablets to pills, using of antioxidants, everything combined. I tell that this is the way to go forward, because we do not want to operate on anyone. We do not want to operate on patients who really are so young and not in that stage. But of course, after having tried all of those procedures, it's going to be the end is going to be a hair transplant. But yes, give them a nice 1.5 year, and let them earn their own transplants. Maybe let them be there with these procedures for really long and grow as much as they can. Give them those kind of talks which will really make them feel, okay, let me just be with this for some more time and some more time, and gain their confidence enough. So I've seen that patients as young as 19 who were losing all their confidence, did not want to go to college and work like that. So I would personally say that if you do a little, maybe that will still give them the confidence and the boost back. But what I really had want to do these procedures, I would have never want to do them. I would have said that no, I think you must still wait for some more time and try to regain those existing hair that you had. And of course, regenerative medicine, nothing like it. But I'm just waiting for something like a hair that is grown in the labs and that can be reimplanted without having to take any more donor. So that is going to be my satisfying day, where we surgeons can easily just pick up hair from a agar agar tray which has already been developed outside, and just you take with the root, and that hair is just implanted with an implanter pen, things like that. And that's what is going to stay in the near future.
I think many of our audience were also not aware of this teenage boldness that you have discussed, and it really breaks them all. Like it doesn't motivate them to go to college or attend some social function events and all. So, like, yes, sir, it's the need of the hour for them.
You
Sir,
won't
one
believe there are
last
people
query.
who come and say they have suicidal tendencies, and they have peer pressure which is so bad that they have not gone out of their house for years together. They've not stepped out of their house. Just imagine with that mental state of health. What we really spoke to people was in COVID was mental health is the most important health. And if I could participate in this, where I could be their mentor, I could be their support, I could just bring them back into living their social lives better. Nothing like it.
Yes, I think many people go into depression also due to this thing, especially for teenagers, I would say. Right, sir. So, one last query, if you allow me to ask, if time permits.
Okay.
Sir, how do you manage donor area limitations and ensure optimal graft survival when extracting like 7,000 grafts in a single session?
Yeah, so as I said to you, we do it in time duration and time bound. The moment we start off taking the strip of skin out, we time the strip, and once the strip is completely bought out, we end the strip time, and then that's where the timer starts. Now again, the FUE starts after the sutures have been semi placed. So once the sutures are placed, and I might turn the patient over, I might just create the slit so that some person can really go back and plant. The implanters usually take over that part, and while they're implanting in the crown area, I can still go and do the FUEs. So implantation is happening from the front part, my extractions are happening from the right or the left side, and that's how the whole process goes together, like a coordinated effort. Hence, the time out of body can be easily controlled. Also, we do try and take a special participation wherein the solution in which the grafts are placed. We might use Ringer's lactate, and of course, we can add some hypothermosol solution, or somewhere even, of course, I have started using PRP solution in which the grafts are stored. So we don't want the grafts to, of course, clump up, because if you put in Ringer's lactate anyway, the grafts are going to be fully clumped. So you can keep them separate, and once the grafts are completely out and they're stored, then you can start using Ringer's lactate in another way. But of course, you will feel that the grafts are getting clumped up, and hence you would probably want to wash them again and then again reuse it. So that becomes a little cumbersome process, and you need more people to help you out. So remember, more the number of people, more the coordinated effort of every person around you will really make the whole process go best. So remember, 45 minutes is definitely the surgeon's time, where he's taking out the strip and closing the strip in a way, and of course leaving a few sutures where the tension is too much, and then you can start doing the FUEs while the implantation is also in the same process going on. So, or we can just maybe start off with the surgery to anesthetize the front, create your slits, turn over the patient, get the strip out, and while the FUEs are being removed, at the same time, simultaneously the FUEs can be planted till the FUT grafts are getting out. So once they are coming to you, and of course they also start to mix with so you start with the crown planting, you finish the top, and then of course while you're coming in the hairline, you have the specific numbers which you still can keep drawing from the back of the head, that you know, okay, fine, I still see need maybe 300 more, I can take some from here, some from there, and so you can manage to fill the frontal area as well. So time coordination, team coordination, and of course remaining coordinated is what is most important.
Yeah. So the surgeon needs to give some time to his patient and allow him to, like what you said, grow with the process, like live the
Yes,
process completely.
absolutely, absolutely.
Thank you, sir. Thank you so much for answering all the queries. And
Thank you
thank
so
you
much.
so much for this insightful and engaging talk. Your expertise and practical perspective have truly engaged our understanding. We appreciate the time and knowledge you have shared with us today, sir. Thank you so much, sir. Thank you once again for
Thank
your
you.
time.
Pleasure,
Thank you,
pleasure.
everyone, for joining, for putting your questions, and making this session a very engaging one. Thank you all. Thank you. Thank you, sir. Thank you so much.
Thank you.